Welcome to the SWIKE podcast, the only podcast that shares the stuff you didn't know you needed to know about jobs, careers, and life. The SWIKE podcast, the stuff I wish I knew earlier.
Hi, everyone, and welcome to another episode of the SWIKE Stuff I Wish I Knew Earlier, the podcast. Today we have our guest mentor, Eram, who's going to help us demystify nursing a little bit. So for those who listened to her introductory episode, you got a good sense of her trajectory and how she got into nursing and all those different things. And I'd love to hear a little bit more about nursing because my sister is a PA, she's a physician's assistant. So I know a little bit about healthcare, but I know there's so much information and misinformation going around there. So I'd love if you gave us a little bit of a context in terms of first maybe starting with nursing and different contexts and all that sort of stuff, and then really diving into some of the myths and misconceptions. So give us a little bit about nursing, like the different forms and shapes that it might take, and what someone who would want to get into nursing could look forward to.
Okay, so thank you so much for having me back again on the Mentor Corner. It's a great pleasure. So different types of nursing. So, when you think of nurse, people are like, yeah, I know what a nurse is. I know what a nurse looks like. Traditionally a nurse would be like someone that wore a white cap, white smock, and there she is doing all the orders for the physician, right? Okay, wrong. It's completely different now. Yep, we do wear scrubs, but not all nurses wear scrubs. And here's why. Nursing is so diversified at this time that nursing could mean that you work in the hospital. So most of the time nurses do work in the hospital. So you could be an emergency and trauma, just like myself. You could be a critical care nurse in the ICU, the CCU. You could be an OR nurse. You could be working as an educator. You could end up expanding and becoming a public health nurse. So those nurses don't wear scrubs. They wear pretty much street clothes like anyone else would, right? Working in the community, working in fertility clinics, becoming an educator, being a school nurse, working with children, being a mental health nurse. That could be in community or outside of the community, working in addictions. There's a lot of the medicinal marijuana support groups for nurses that are involved there. There's also a lot of cosmetology in nursing that's involved. And a new, very popular line of nursing that has now risen is Botox injectors. So a lot of the nursing is also getting into the cosmetic field now. So nursing is not what it traditionally used to be known as. It's expanded. It's heavily and highly diversified. And you'd be quite surprised when you go out there and you meet them, what you can find.
That's amazing. And yeah, I wouldn't have known of all the different things, but I did have a sense of a few of them, but some of them are just like, no, I wasn't really sure about that. And with that variety of different kind of nurse practitioners, nurses that are in different areas. So what are some of the most common kind of myths and misconceptions that you'd want folks to know about? Because I'm sure with every profession there are some, but nursing is probably one, especially with that great variety that you just shared. There's probably a lot more than some others.
Okay, so there is a lot of misconceptions about nursing that I think should be clarified. And I think that's a great question that you're asking. So I want to kind of get through with that with you. So first of all, nursing is not just a female-dominated profession. Men can also be nurses as well. So I think that's great that we're getting men and more males into the field. It's heavily diversifying the field even more. And I think what's also important is that when you see a male wearing a stethoscope, don't make the assumption that he's a doctor, because there's this conception, this notion that, if it's a male wearing a stethoscope, he's automatically considered a physician. Males can also be nurses as well, just as females can be physicians as well. So let's not make that assumption. So I think that's one thing that we need to definitely clear the air on. I think another thing would be that when you go into nursing, I don't think your academics would be enough to say you know everything. Yes, clinicals are awesome. They give you the hands-on experience of things. But those clinicals and those courses that you took are not enough. Textbooks, again, you're not always going to have a textbook situation. A textbook patient isn't always going to be walking in. Yes, it'll give you hindsight. It'll give you an idea. It gives you more thought into thinking, okay, so if I see a classic condition of someone coming with chest pain and angina, here's what to expect. But not all patients come that way. So just like nursing, where they come in different shapes and sizes and forms, that also applies with patients as well. So your populations vary. If it doesn't matter if it's pediatric, if it's the elderly, if it's women's health, mental health, addictions, anything like that, it's not always the classical case that you're going to see in your textbook. So please don't think that it's just going to be written as is, black and white. Things could change. We live and we work in a dynamic environment. Things are always changing. Things are never static. So that's something that's really important as well.
And do you have a story of maybe something that's like, because a lot of school assignments, not just in nursing, but anything, it's kind of dumbed down and simplified so that it fits in the kind of box of, well, there's these four critical areas, but in the real world, it's not so black or white. A lot of it is different shades of gray. So do you have a story that you could share in terms of something that wasn't textbook or was textbook and then didn't end up textbook or something like that?
So I can give you one example that actually just comes into my mind right now. An example of a lady that had been complaining of diffuse right and left upper quadrant pain. So you'd think in terms of nursing, well, I wonder if she has gallstones, cholelithiasis, any of those types of conditions. Maybe she's got something going on with her liver, and she walked in perfectly alert, oriented, ambulatory, was able to describe everything. She wasn't disoriented, and she was triaged in, and she was sent into one of our observation areas, one of our areas where a patient gets to have a bed, and so she laid in the stretcher. Everything was done for her. And, you'd think, okay, well, it's probably just a bit of gallstones. Maybe she'll just need to, stay for a bit, and we'll get all the medications, we'll get her fluids in and everything. But she just suddenly turned. She turned, and it turned for the worse, unfortunately. So what ended up happening was that this lady became progressively confused. This was a laughing, talking, lovely lady that I had spoken with, that suddenly became confused, that suddenly just turned waxy and gray looking, whose blood pressure just started dropping, just basically not doing too well. So she became very critically ill at that point, which is where I had to go in, put on my thinking game. And I'm like, okay, let's go. We have to do this. And it turns out that she ended up having a tumor on her spleen.
Wow.
which ended up rupturing.
Wow.
Right, which ruptured, unfortunately. And she was not too well. Unfortunately, we had done as best as we could with a massive blood transfusion, every life support drug that you could think of, pressure support drugs, getting the intensivist involved, everything, just everything that we had done. But unfortunately, she did not make it. So that's why when I say, please don't just look at it as a textbook situation, which is what everyone else had thought. But then I just had a bit of a suspicion thinking, okay, something doesn't seem quite right here. So that's why you can't always make the assumption that, okay, yep, textbook situation, I've seen it. Yep, I know exactly what it is. You have to be able to have these experiences. And that was, unfortunate that it happened to her. But you have to have these clinical experiences to understand that not everybody is a cookie cutter. You know what I mean? Not everyone is going to come out the exact same. So this is what we need. We need the diversity. And this is what helps you learn and strengthens your learning and gives you more potential and opportunity to look forward and say, okay, so what else is out there? What else is there that I can, that could possibly come in and, I've made this assumption, but it ends up being something else. So I think that would be one example.
That's amazing, and definitely that's not necessarily a misconception just in nursing. That's probably in all lots of life in different industries as well. But obviously, there's a lot more on the line when you're dealing with someone's life and health and stuff in there. So yeah, thanks for sharing the story. Yeah. What are some other myths and misconceptions that would be helpful for those that are getting into nursing to know?
I'd probably say that nursing is not, a nurse is not just a nurse.
Okay.
Nursing is not just someone that brings apple juice, someone that brings you a bedpan because you have to go to the bathroom. A nurse is someone that has a lot of capability and intellect. Someone that is the physician's right hand. Someone that takes over if the physician cannot. Someone that has the second set of eyes to say this was missed or this is going to go through the cracks. We better catch it quickly. We have to catch this immediately before things start going south. And it would probably add on to another misconception, which is people think, or when people make the assumption that nursing is a low skilled profession, it's not. Nurses are more than that. Nurses are individuals that provide comfort care to those who are imminently dying, or people that are sick, people that need comfort care, palliative care. Nurses are there to help a woman give birth. I've been part of miraculous miracles where a woman is there and we assist in giving birth. I've been part of life. I've seen death. I've seen children very sick and how we revive them so much. I've been part of situations where people are so sick, or, you're doing CPR on them. You're helping out with getting them set up on ventilators. You're helping them out with life support drugs. Any of those things a nurse is part of, a nurse takes part in heavily. The role is very, very heavily centered on that. So the next time I ask anyone out there, the next time when you see a nurse, please remember they do more. They do a lot more than what you think. And I think it's really unfortunate because sometimes I feel as if these misconceptions and these ideas are implanted in because either people just don't know, or it's because the media has kind of centered that on there. And they really need to outline and highlight what nurses really do.
Absolutely. I think that in some of the kind of normal conventional wisdom is that, well, the doctor is kind of the star, right? And then the nurse is only kind of like the supporting in a supporting role. But oftentimes the nurse, if you think about it, of who actually takes care of the patient, it's a nurse that's with the person more often than the doctor is. So someone who's on the screen for, let's say, a minute versus someone who's on the screen for the other hour, like who has more of a starring role. So I definitely give kudos to a lot of the nurses out there as well. So are there other misconceptions that would be useful for folks to know before they decide to go into nursing?
Well, I would say that nursing is all about continuity of care. You can't change what comes in. You can't change what will happen to anybody. Doesn't matter what type of a nurse you become. It's always continuity of care. So if you're coming in on shift and you're like, I'm going to be starting with a nice clean slate, you better think again, because you don't know what's coming in. So what I say is, it's not always going to be the prettiest when you go in. Some days it could be excellent. You come in with a clean slate, but then 10 minutes later, you get 4 patients in, you get about maybe 10 patients in, depending what area you're working in. and you have to get them going. You have to make sure everyone's seen. You have to make sure all your workups are done. You have to make sure all the results are in. They need to be reassessed. Does someone need to go for diagnostic imaging? Was this one triaged? Are we reassessing this one for hydration therapy? Are we assessing the fever on this child? Things like that. So it's always going to be a 24-hour job. So if I'm on, for example, on shift work, 12 hours, next person's coming in, sorry, this is pretty much all of this has been done, but there's some little things that you're going to have to take over on your shift. And so it takes over. So the cycle just keeps on going. It's never going to finish. It's always 24 hours. That's why I say nursing is a 24-hour job.
Yep, definitely. It's taking care of other people has a lot of responsibility to it. And it's amazing for those who actually pick that as a profession in order to give that up for all of us. So definitely respect that for them. So what are some other things that folks should also learn about?
When you go into the profession of nursing, please learn to have an open mind. And when I say this, what I mean by that is, please get out of this complexity in your mind where you think, okay, I'm the nurse, I don't need to speak with anyone. That is completely false. When you get into nursing, you have to learn to work in a team. Even if you're working, for example, individually, you still have to intercollaborate with everybody else. That could be physicians, patients, their family members, anybody that's part of the team. If you're in a hospital, you'll probably have to speak with social work, the dietitian. You may have to speak with other nurses. You'll have to report to your charge nurse, the diagnostic imaging department, any allied healthcare professionals. But also what I'd like to say is, please make sure you have respect for all these professions, because there's more than just these professions that are in healthcare. Especially if you're working in the hospital, and that could be your PSW, so your personal support workers that help and aid in the care of basic daily activities of living for patients. It could be porters and transporters. It could be environmental services. Please don't have this concept saying that, I'm the nurse, that's it, I only speak with X, Y, and Z. It doesn't work like that. You have to learn to have an open mind. You got to learn to have respect for people, because you never know. Anyone could be your greatest help. You never know. So that's why I say, please learn to have respect for all professions, no matter who they are and where they come from.
It's interesting, because what speaks to me is that it's something like a doctor will only speak to other doctors because everybody else is beneath them. But at every job, there's kind of this hierarchy where, like, I'm at this level and I will only speak to other people. But really, we're all at the same level, right? Nobody's job is any better than others. And we're all kind of in this web of like who's important right now, because at every point in time, someone's on center stage, and then other people will come in and out. But yeah, I think that's a good point, that respect, and I think that goes across the board, not necessarily just in nursing, but maybe especially so because there are lives on the line there. So what else do we have, Eram?
I probably would say, please don't place labels on patients. Because tomorrow that could be you, and you don't know what each person is going through. People respond to a crisis and illness very differently from you and I or anyone else out there. And yes, I do understand we can get frustrated. Everyone gets frustrated sometimes. That's why we're human. But please don't place labels on people, because you don't know what they're going through. If there's something I would say, it would be kind, because everyone is fighting their own battle. You don't know what they're going through, and tomorrow that could be you as well. So you'd want to be treated the way that you treat others. So it's more like a give respect, get respect. It's like the golden rule: do unto others as you would have them do unto you. So that's what I would strongly suggest, is to bring a neutral and unbiased and non-judgmental attitude when you go into this profession.
I think that's amazing. I think that again applies to pretty much all professions, but obviously is magnified in nursing, in the sense that when you have that empathy, that knowing, that understanding of this other person has something that they're potentially going through that you have no idea. I think it's something to be mindful of. And in addition to the golden rule, what I've been telling a lot of folks is instead try to adhere to the platinum rule. And what the platinum rule is, do unto others as they would want have done unto themselves, right? Because sometimes you want something done unto you, but that's not necessarily what's best for that other person. So thinking about it from their shoes, their perspective, what would be the best way to care for them in that respect, irrespective if you're a nurse or in any job. I think that's important. And I think that's a great place to end off the episode. So you gave us a lot of information, a lot of necessary things that are kind of myths and misconceptions. Hopefully you've brought a bit of truth to folks, opened a few eyes in regards to what it's like to be a nurse and kind of the whole diverse set of different roles and responsibilities that they have. And yeah, thanks so much for sharing. And hopefully we'll get into more aspects of nursing and other parts of healthcare and different parts of careers in future episodes. So thanks a lot for sharing, Eram.
Thank you so much for having me here. It was a great pleasure.
Thanks for joining us on the SWIKE, Stuff I Wish I Knew Earlier, the podcast. If you like the podcast, please subscribe on iTunes, Stitcher, or wherever you found this podcast. And if you can give us a review, that would be very appreciated. Feel free to contact me on LinkedIn at Lukidanu, Lukidanu, and the same on most social media platforms. And I look forward to hearing from you. Thanks. Bye.